Hey everybody, it's Kimberly, and I wanted to hop on today and talk to you about this is Dental Care Awareness Month. And a lot of times we don't even think about our teeth unless we have a pain or a discomfort. But I wanted to share with you a little bit about what I know about teeth. With doing Meridian Stress Assessments, one of the meridians that we do check is the dental and the jaw. And amazingly, many times we see some challenges here. And they can be what's called subclinical, or a way that you can't actually see from the doctor or the dentist when you go see him. So if he does an x-ray, go, no, everything looks fine. One of the best ways that we've been able to assess what's happening in the root area of the teeth is to do a cone beam scan. So you could talk to your dentist about having a cone beam scan. Or if you're one of our clients, when we have a visit, you can always ask me more about that. But I will tell you if I do see something going on in the dental area. Another thing is to ask yourself, do I have problems with my TMJ over here, this joint when you open and close? This actually isn't like a joint like your shoulder joint, which is a ball and socket, or it's not like the knee, like a hinge. This is actually a free floating. There's lots of ligaments in here. So many times people will click and they'll pop as they open and close their mouth when they're chewing. So many times it is this ligaments that need more minerals. So we do have a recommendation through our office that we make for this joint here specifically. My husband used to chew and he'd pop and crackle and it made so much noise. And he went on the supplement for 6 months and it was amazing. So the only way I can make recommendations for supplements is if you are our clients. It's something that we have to do. So I apologize, I can't give you the name of the supplement, but it is definitely a joint that you want to pay attention to. Also, if you have problems with grinding your teeth, or if your doctor, or I should say dentist, tells you have wear patterns on your teeth. A lot of times if our jaw is off or our bite is off, we'll clench our teeth trying to get that joint or that jaw back into alignment again. Another way it could be is that you have a parasite. Sometimes we don't even talk about parasites in our culture, but believe it or not, we do see a fair amount of people that have parasites. So we do GI panels to be able to help our clients assess whether we see a parasite in their GI tract. So just wanted to be aware of things that can go on with this dental area. Every organ system has a meridian that correlates with a tooth. So many times there is a problem with a tooth, could also be associated with a problem with an organ. I have read in one of my doctors she's had breast cancer twice, one of my doctors that I follow. She said that 95% of women that get breast cancer have a root canal on the tooth that has the breast, is related to the breast. There's a tooth on each side related to our breasts. So if we have a root canal in those teeth, and if that root canal has gone bad or there's an infection in that area, it could put you at a higher risk for getting breast cancer. So that is just something for you to be aware about, or something we can talk about at one of our visits. So just want you to be aware again of these teeth. It's very, very important that we keep our teeth healthy. And if you have problems with sensitive teeth and that gum line's actually receding away from the tooth and exposing that root, you'll find that you're much, much more sensitive to cold, heat, sweets, things like that. So we can talk about that more as well in the future. But it's not so fun when we have these problems. So just because we have no pain does not mean that there's not a problem going on. So if you have questions, feel free to let us know down in the comments, contact our office. Also, if you have done thermography or haven't in the past, that's one good way to see things going on with the teeth. We look at physiology in the body, and so the mouth always shows up, colors, hot or cold, and we can see things that are going on in there. So it's kind of fun to see those images, to see what's going on in the mouth, the jaw, and this whole area. So I hope this is helpful. I want you guys, encourage you guys to be aware of your oral health. It's extremely important. And it really plays out to a lot of our organ systems too. So I appreciate you guys watching. Thanks so much. I hope you guys have a great rest of the day.